back, everybody. Time for our monthly visit with Dr. Rhys Branman. Good to see you.
Good to see you.
Yeah, you know, everybody's going to the pool now, and they may be seeing some parts they don't like.
Sometimes they do see that.
Yeah.
That's right.
And I think the tummy is one part, especially women.
I think
and men too, I guess, you know, that as we age.
It's a big area that can be bigger, and we like to make it a little smaller sometimes.
Yeah.
And bathing suit season sort of accentuates that, and I think an abdominoplasty or a tummy tuck is one of the ways that we can make the tummy a little bit smaller.
Okay, we're going to talk all about it in case you've ever thought about it. But first, let's take a look at some pictures and the results of what you've had with some of your clients. And here's a look at one.
And this is, this is a smaller change. We see this sort of bulging of the abdominal muscles, and what we did is we tightened those muscles and gave her a nice flat tummy. You can also see that the incision line is way below, sort of near that bikini line, so it's going to be very well hidden in a nice bikini. Okay,
so you said a smaller change. So this is someone who's just...
Who's had children, just had a little bit of wrinkling, had some loose skin, and they wanted that tightened up.
Okay, and this one?
We've got a little more fullness here, a little bit of heaviness in the tummy. What we did is we brought everything down, got rid of some, did a little bit of liposuction with that.
Okay.
And again, you can see that bikini line, and you're not gonna be able to see it.
Right,
It's beautiful. And we gave her a little cuter belly button.
That's right, it is a little cuter. It's a little rounder.
That's right, it's a little rounder, a little cuter.
All right, and let's take a look at another one.
Now this is a lady who's had even more. You can see all this looseness right here in the tummy. And so what we did is we freed everything up, tightened her muscles all the way from her rib cage down to just above that pubic area, gave her a new cuter belly button. You can see that again, and put that incision very low so that she can also wear a nice bikini.
Does the belly button, does its placement change any?
The placement stays the same. The belly button stays right where it is, just all the skin around it moves down. Everything from this point in the belly button all the way down is gone. And we moved everything from up here down to there.
Very interesting.
Yeah, it's very exciting.
We could continue looking at the pictures, but we want to talk about a few of the points you wanted to make. First of all, who is a good candidate for this?
Well, the best candidates really are women who have lost weight, or men, lost a lot of weight, and they have a lot of loose, sagging skin. You really can't exercise away loose skin. Another group is women who have had children, sort of that mommy makeover that you've probably heard about, where the abdominal muscles have spread apart, and we need to tighten them back together and then get rid of the loose skin. Those are probably the two groups that we see the most of.
Okay, and how much are those muscles tightened?
They're tightened pretty good. They're tightened from the rib cage right about here all the way down to the pubic area, so this entire length of the tummy. And so you've probably done sit-ups. I have too. Hard to get those tummy muscles tight. We can do it for you.
You can do it.
That's right.
All right. And let's talk a little bit about the recovery. Does it require an overnight stay?
Not an overnight stay particular. Usually people go home the same day unless they're having other procedures with it. And the recovery takes about a week. They have a little pain pump in, some drains, and they come out within about a week. And then they're back to their basic daily activities.
Do you have to wear anything special during that recovery time?
We put them in a little abdominal binder, a little cincher that kind of keeps them tight, keeps everything down, and makes it heal up real quickly.
So it's probably about a week out of work or whatever you do normally.
You're going to be a week out of work, but it's really well worth it.
Yeah, absolutely. Really and then what about the scars? Because we saw that they're still wearing their bathing suits.
That's the part I like the best, because we can hide all the scars within the bikini line and keep it really well hidden so that you can go and wear pretty much anything you want to wear today.
Yeah. Talk about one of the pictures. You said they had lipo along with it, so you can combine that.
We can. In certain cases, we can combine a little bit of liposuction, especially in this area right around the flank area, with the tightening of the tummy to get a very nice result.
Because some people, you said, usually it's someone who's lost weight, they have sagging skin. What if someone says, I can't lose that weight? It's there.
It's there.
I want to lose the weight and get the tuck.
We can help them lose it.
Exactly,
there you go.
Are you seeing this, of course, women in our pictures here, but what about men?
We're seeing it with men, but not quite as much. Men tend to have a lot of weight sort of in that tire that goes around the waist there, and in the love handles. And sometimes when they have lost a lot of weight, we will do a tummy tuck on them because they do have that extra skin that's down low, and they just can't get rid of that.
So again, if someone is curious about this, but they're just not sure if it's for them, what should they do as far as
They need to come on into the Cosmetic Surgery Center.
Yeah.
Consultation, we don't charge for that, and we'll give them an idea of whether they need liposuction, a tummy tuck, or maybe a combination of both.
Okay, very good. And let's put up the information, of course, about Dr. Rhys Branman. It is the Cosmetic Surgery Center on Executive Center Drive out in West Little Rock. And there's the phone number for more information. If you'd like to just give them a call and ask more questions, do that. They're happy to answer your questions at 227-0707. Thank you so much.
Thank you.
We appreciate it. We'll
again.
see you again next month with
Okay.
some more information.